Hello, my name is Anna Danas, and today I will be sharing my presentation on the effects of a progressive strength training program on pain in men diagnosed with fibromyalgia, and this is a randomized controlled trial. So, before I begin, let me give a little bit of background. It is estimated that about 4 million Americans suffer from fibromyalgia. Fibromyalgia is a severe and very poorly understood disease on the autoimmune spectrum. Now, autoimmune diseases, just for a little bit of explanation, are those diseases in which the body attacks its own tissues. While fibromyalgia is not formally recognized as an autoimmune disease, most doctors relate it to autoimmune diseases because that is the best way that they are able to understand it. Many options have been postulated as possible treatment for fibromyalgia sufferers, and the front line of treatment is generally pain medication, but these medications cause many severe side effects, which have led researchers to begin looking at other lifestyle type interventions for fibromyalgia. This has led to cardiovascular exercise being validated for symptom management in those suffering from this disease. But further research is needed in relation to strength training or resistance training and how that affects those suffering from fibromyalgia. Additionally, there is a significant gender gap in research related to fibromyalgia. This means that very few men are actually included in fibromyalgia research trials, which we will come back to momentarily. So, what are my specific aims? My objective in the study is to test whether strength training program will significantly decrease the pain experienced by men with fibromyalgia. I hypothesize that a progressive, full-body strength training program incorporating traditional barbell and free weight exercises will significantly decrease the pain experienced by men with fibromyalgia. I have two specific aims in my study. The first is to determine and categorize the specific degree of pain reduction that results from the above-mentioned strength training plan. And the second aim is to determine if a 6-month intervention period is sufficient to yield significant pain reduction. So, what is the significance of my study? Well, as mentioned earlier, it is estimated that 4 million individuals in America alone suffer from fibromyalgia, but when you consider the worldwide population with this disease, the number expands to 300 million people. This is very significant because unlike most diseases, fibromyalgia is not considered treatable, and this is mainly because doctors do not understand the actual root cause or the root reasoning for the disease, what is happening, why it is occurring. When you have diseases such as metabolic problems or cardiovascular diseases, for example, we understand to some extent what is causing them and can, in a way, treat the root cause. However, with fibromyalgia, this is not the case, and that means that patients with the diagnosis of this disease are forced to live with severe, widespread pain and other symptoms that go hand in hand with the diagnosis of fibromyalgia. These symptoms include chronic digestive problems, insomnia, debilitating headaches, inability to socialize, dizzy spells, lack of physical activity, weight loss or weight gain, nausea, and often depression. Because of the wide range of symptoms that go along with this misunderstood disease, researchers have sought to find a way to decrease fibromyalgia symptomology in patients with this diagnosis. Many different studies have examined exercise as a means of relieving some of fibromyalgia's pain. Yet the focus, as mentioned earlier, has been largely on cardiovascular and endurance interventions. Indeed, very minimal research has actually been conducted relating to the impact of resistance or strength training on the pain markers of fibromyalgia. Additionally, there is a significant gender gap in fibromyalgia research. Men are diagnosed with fibromyalgia less frequently than women, which means that as a result of this, treatment studies have largely excluded males, with only a minimal 2% of fibromyalgia research trials actually including men. This leads to a significant gender gap in relation to resistance training for fibromyalgia symptomology, and it also means that the results are not at all generalizable to the general public with this disease, but only to the female population. So this is where my study comes into the picture. My study will provide more generalizable treatment options for the male fibromyalgia population as well as the existing research on the female population. We will also decrease pain and isolation experienced by male fibromyalgia sufferers. And finally, we will decrease the economic burden that also plagues this population. It is recognized that individuals with fibromyalgia often pay 2 to 3 times the medical bills that the general public does as a result of the severity of their disease and the lack of treatment options that exist. My study is innovative in a few different ways. Firstly, all subjects are male, and I will note mine is the very first study to be conducted in which all study participants with fibromyalgia are male. In the past, some studies have included males and females, though as we saw above, that is less than 2% of all clinical studies that have been conducted on fibromyalgia. And most studies, the other 98%, have included all females. Mine will be the first study to include all males. Additionally, I will look at a 24-week intervention period compared to the typical 12 to 14-week duration. It is my hope that this longer study period will elicit more significant data. I will also be conducting the intervention 3 times per week compared to the 2 times per week that has been used in the minimal amount of studies that have actually examined strength training in fibromyalgia. Finally, I will be utilizing traditional full body strength programs, not machine-based exercises. I must note that the studies that have examined some resistance training type interventions have done so mostly in the context of physical therapy or occupational therapy, where work relies heavily on bands, body weight, or very, very light free weight exercises. So I wanted to conduct a study where we are examining the full resistance training plans. So we're doing a normal strength-based plan with compound lifts and accessory exercises like one would do if they were to go into the gym with the goal of building strength. My research design, I have a randomized controlled parallel design trial. I will be examining 2 correlations. First is the correlation between strength training and fibromyalgia pain reduction. And the second is the correlation between the duration of the intervention and the degree of pain reduction that we see. And that is going to tell us whether pain reduction is greater at 24 weeks compared to 16, compared to 12, etc. That way we can really fulfill that second specific aim. As far as my recruitment protocol, my inclusion criteria is that, as stated above, all subjects must be male. They must be between the ages of 18 and 65. This is because younger than 18 would be young adults and older than 65 would be considered elderly, and these populations both respond to exercise differently than the adult population, and we wanted to eliminate that possible confounding variable from our study. The study participants must also be experiencing fibromyalgia symptoms, especially pain. They must be diagnosed with active fibromyalgia by a practicing rheumatologist. They must have no pre-existing medical conditions. Again, that would most certainly introduce confounding variables into our study, and we are trying to eliminate those. And finally, they must have full availability for the duration of the study. The participants are going to be asked to come to the lab 3 times per week on Monday, Wednesday, and Friday of each week in the 24-week intervention. Therefore, it is pivotal that they are available to come to the lab during each of these days. The exclusion criteria is basically the opposite. So they cannot be female, younger than age 18, or older than age 65. They cannot have pre-existing conditions. They cannot have only limited availability. And also of importance, they cannot perform regular weightlifting already, as this would introduce another potential confounder into our study variables, because their bodies would already be used to the added stress, physiological stress of weightlifting. And so we wanted to eliminate that and be sure that any results we are seeing are not due to pre-existing physiological adaptations, but adaptations that take place as a result of our study intervention alone. Once we exclude those who are not able to take part in the intervention, our remaining 46 participants will be randomized into two groups: the strength training intervention group, made up of 23 individuals, and the non-exercise control group, made up of the other 23 individuals. And it is important to mention that this number was increased by 4 people to account for a potential 10% dropout rate that is frequently seen in studies. Our research design will follow this breakdown that we have here on the screen. So we will begin with some baseline measurements once I gather both groups together. So we will begin with height and weight and other anthropometric measurements. We will then move on to heart rate. We will do a functional fitness movement screening. This measure has been validated for populations that are clinical or have pain or are elderly, and that is simply going to examine the functional capacity of our patients. So that is going to be looking at range of motion in different joints, things like squat tests, sit and stand, step tests, wall tests, T's, that kind of thing, to really assess their functional capacity. We will also be examining the Pain Disability Index, which is a brief one-page document simply asking the patients to rate how their pain affects their day-to-day living activities, how much they feel they are disabled by the pain that is a symptom of their fibromyalgia. And we will also ask them to fill out the brief WHO-5 Wellbeing Index, which is a short survey that is simply going to examine how their pain and other fibromyalgia symptoms is really affecting their mental health. So basically, it is a short depression screening. We're also going to perform baseline testing. This testing consists of estimated 1 repetition maximum testing, and this will be performed by a licensed exercise physiologist. It is important to note that we are only going to be doing estimated 1 repetition maximum testing, not full 1 repetition maximum testing. This is because full 1 rep max testing is very, very difficult and strenuous on the body, and for a clinical population such as those with fibromyalgia, it is not safe to put them through exercise regimens that are this intense, as it would cause them severe pain and they would probably have to drop out from the study. So for this reason, we chose to use an estimated 1 repetition maximum. Once the numbers are determined for each of our participants, a progressive overload strength program will be designed for each participant individually. The intensity will begin at 45% of their 1 repetition maximum, and over the course of the 24-week study will progress up to 80% of their 1 repetition maximum. On weeks 1 through 24, the participants will come to the lab 3 days per week on Monday, Wednesday, and Friday. As soon as they arrive, pre-exercise, they will have their heart rate measured, and they will also fill out the pain intensity scale, which is simply a measure from 1 to 10, rating how much pain they're in at that time. It is worth noting that they will repeat these same measurements once they complete their exercise program for the day. The exercise program consists of a 10-minute warm-up, 2 compound exercises such as squat and deadlift, 3 accessory exercises targeting areas of the body such as the arms, the abdominals, and the back, and then a 10-minute cool down to really facilitate exiting the sympathetic nervous system and entering the parasympathetic nervous system. On week 6, 12, 18, and 24, the participants will undergo deload training, in which they will continue the exact same training plan, except their intensity will be 20% less than whatever VO2 max, 1 repetition maximum they are currently working at during that week. Incorporating these deload weeks into the program will help to protect our participants and ensure that they do not undergo burnout or pain or injury in any form. It is also worth noting on these 4 weeks, weeks 6, 12, 18, and 24, all baseline measurements will also be repeated. Finally, post-intervention, so week 25, baseline measurements of height and weight, heart rate, functional fitness, pain disability index, and the WHO-5 Wellbeing Index will be repeated. Once we have gathered this data, we will run analysis with the SPSS computer software. We will be examining 2 correlations. The first will be a two-tailed Pearson bivariate correlation. This will be examining pain reduction in strength training intervention group compared to the non-exercise control group. We will also run descriptive analysis on the groups to examine more variables, and our significance is set at equal to or less than 0.05. The next correlation we will run will be a two-tailed partial correlation, and this will examine pain reduction and its correlation with the duration of the study. So as we mentioned earlier, that is looking at the significance of pain reduction in relation to the 24-week study intervention period. Again, the significance for this test will be set at 0.05 or less. So overall, the goal of my study is to really help to narrow this gap in research in fibromyalgia with men. We want to yield generalizable results that will help the male population as a whole with fibromyalgia, because right now the only data that exists relates to females. By doing my study, I will be helping to improve the mental health, the physical health, and the financial health as well of men and women also with fibromyalgia. And this will greatly improve their quality of life. So here are my references. And thank you for watching my presentation.